My name is Bob Cobley, and I'm the owner of Spectrum Lasers. I've owned this company for 28 years, and today I'm going to talk a little bit of how to charge for laser gingival recontouring. I'm going to screen share this, and there we are. Charging for laser recontouring. Now, there's a lot of different ways to do this, and a lot of it's all about the presentation. But some of my doctors, what they'll do is in the initial consultation, they'll mention to the patient that after treatment, oftentimes the gum tissue needs to be shaped. And we're not going to send you to the periodontist for $5,000 for this. We have a special laser, and we're going to shape this gum tissue and make it look beautiful like this. And we'll show them a case. Now, a lot of my doctors um, will not charge for little cuspid exposures and access gingivectomies, but you let the patient know that if I sent you to the surgeon, this would cost about $1,800. But we have a special laser, and we're going to go ahead and do this and save you a lot of time and a lot of money. But if it was a bigger deal, then we would have to charge, hopefully priming them for later if it is a bigger deal. So what you'll do when treatment is finished, you're going to have your current patient on the screen and a before and after, which you can get from me until you have your own. You'll say little Julie's done a great job wearing her elastics, etc. Everything's lined up. It's a beautiful result. But this gum tissue needs to be shaped like this case below here. Our options are is I could send you to the periodontist. Unfortunately, going to cost $4,000 or $5,000. But in our office, we have our special laser, and I can go ahead and shape this gum tissue and make it look beautiful like this. No discomfort during or after, no bleeding, etc. Heals up in a couple of days. We have to charge a nominal fee of $500 for this. And they'll say, well, I thought this was going to be included. Well, laser equipment is expensive. So we do have to charge a nominal fee. So, and I worked with Dr. Pitts and the Pitts Masters, and we talk about this. So either you're going to charge or you're not going to charge. So you can't do some of the patients for free because, well, you didn't charge Julie. Now you're charging me. So if they decline the treatment, you let them go. Chances are they're going to come back anyway. So um, I I have 5 or 6 years ago hardly anybody charged. Now I would say at least 50% of my orthodontists do charge about $500 for recontouring. Now you charge more if it's not your patient. Um, and I mean, 100 cases is 50,000, and I have many offices that do 200 plus cases a year, and some do almost all their cases. And it's a lot of money, but it's also a lot of time because if it takes you 15 minutes to do a case, 100 cases, 150 minutes. So I really urge you to consider charging for this. Also, in a new patient exam, the type where they're going to 2 or 3 different offices to see who's going to do their treatment, show them a case like this. And you can get it from my website to have your own and let them know that you do this here in the office. You shape the gum tissue because they don't know. I mean, Dr. Pitts says that the patients, they don't know what they want until you can show them they can have. So if they go to you and you show them you do this, have this technology, and you do it, they go down the street, and chances are that they don't have a laser anyway. But even if they did and they didn't tell them, patients wouldn't know. So that's it. And I really urge you to consider charging for gingival recontouring. Thank you.